I'm going to be talking about the human immunity. I'm going to demonstrate my understanding of the human immunity by describing the first and second lines of defence, explaining the third line of defence, explaining self-recognition, tolerance to own tissues and rejection of transplanted organs, describing two specific immune system disorders, the categories of acquired immunity including natural, artificial, passive and active, explaining the immune response to vaccination including immunological memory, evaluating the benefits of vaccination by analysing measles infection rates in the UK between 1940 and the present day, discussing the concept of herd immunity, vaccination programmes and factors affecting vaccine uptake. The first line of defence is non-specific and aims to stop microbes from entering the body. The skin and mucous membranes function as a physical barrier preventing penetration by microbes. If the skin is cut, then the body produces a clot that seals the wound and prevents microbes from entering. The surface of the body, the skin, digestive system and the lining of the nose are covered by a community of microbes called the normal body flora. They help protect the host from becoming infected with more harmful microorganisms by acting as a physical barrier. The normal body flora colonises these linings that reduces the area available for the pathogens to attack and become established. It also means that the harmful microbes must compete with the normal body flora for nutrients. The respirational system, the nose and passageways lead to the lungs, is lined with cells that produce sticky fluid called mucus that helps invading microbes and dust. Tiny hairs called cilia move in a wave-like motion and waft the microbes and dust particles up to the throat where they are either coughed or sneezed out or swallowed and then passed out of the blood in fauces. The body produces several antimicrobial substances that kill or stop microbes growing. For example, the enzymes in tears and saliva break down bacteria. The stomach produces acid that destroys many of the microbes out of the bladder and urethra. If microbes do manage to get inside the body, then the second lines of defence is activated. This is also non-specific as it stops any type of microbe, phagocytes that are a type of white blood cells that move by amoeboid action. They send out pseudopodia that allows them to surround invading microbes and engulf them. Phagocytes release digestive enzymes that break down the trapped microbes before they can do any harm. This process is called phagocytosis. The third and final line of the defence is the immune response. The invading microbe or pathogen is called an antigen. It is regarded as a threat by the immune system and can stimulate an immune response. Antigens are proteins that are found on the surface of the pathogen. Antigens are unique to that pathogen. The whooping cough bacterium, for example, will have different antigens on its surface from the TB bacterium. When an antigen enters the body, the immune system produces antibodies against it. Antibodies are always Y-shaped. It's like a battle with the army, fighting off the invader. A type of the white blood cell called a lymphocyte recognises the antigen as being foreign and produces the antigen that are specific to that antigen. The antibodies destroy the antigen that is engulfed and digested by macrophages. White blood cells can also produce chemicals called antitoxins that destroy the toxins some bacteria produce when they have invaded a body. Tetanus, diphtheria and scarlet fever are all diseases where the bacteria secrete toxins. Once a person has had a disease, they don't normally catch it again because the body produces memory cells that are specific to that antigen. The memory cells remember the microbe that causes the disease and rapidly make the correct antibody if the body is exposed to infection again. The pathogen is quickly destroyed, preventing symptoms of the disease occurring. Transplantation is the process of moving cells, tissues, or organs from one site to another, either with the same person or between a donor and a recipient. If an organ system fails or becomes damaged because of disease or injury, it can be replaced with a healthy organ or tissue from a donor. Organ transplantation is a major operation and is offered when all other treatment options have failed. The immune system plays a critical role in transplantation. The complex mechanism of immunity that under normal circumstances work to identify foreign bodies and direct the immune system to destroy them pose a significant barrier to successful transplantation. Rejection of a transplant occurs in instances where the immune system identifies the transplant as foreign, triggering a response that will ultimately destroy the transplanted organ or tissue. The intensity of the immune response against the organ or tissue, also commonly referred to as the graft, will depend on the type of graft being transplanted and the genetic disparity between the donor and recipient. To reduce the possibility of rejection, the donor and recipients are carefully matched for immune compatibility prior to transplantation. However, the small pool of eligible donors can make it difficult to find a donor-recipient match, and there will always be a degree of rejection against the graft. Manipulation of the immune system can support long-term survival of the graft, ensuring that every transplant is as successful as possible. When the immune system encounters a foreign organism, it mounts an attack against it to protect the body from infection. To prevent an attack on our own cells and tissues, the immune system must be able to differentiate between our own healthy tissues and foreign invaders. Foreign invaders are presented in the immune system in the form of small molecules called antigens. Identification of these non-self antigens will trigger our immune response and will stimulate the production of antigen specific antibodies that mark infected cells for destruction by the immune system and help amplify the immune response. The human leukocyte antigen, HLA, complex is a group of genes that encode the proteins responsible for identifying foreign agents to the immune system. These proteins are found in the surface of all cells and act as self-markers, telling the immune system not to trigger as a response. Each person will have their own specific set of HLA proteins based upon their unique genetic makeup that the immune system will have learned not to react to. Any cell not displaying these specific HLA proteins will be identified as non-self by the immune system and will be treated as a foreign invader. Hyperacute rejection occurs within minutes or hours after a transplantation is caused by the presence of pre-existing antibodies of the recipients that match the foreign antigens of the donor, triggering an immune response against the transplant. Acute rejection occurs with the first 6 months after transplantation. Chronic rejection, repeated episodes of acute rejection can ultimately lead to chronic rejection of the graft and failure of the transplant. Eligible donor recipient match consists of ABO blood group compatibility, tissue typing cross matching, panel reactive antibody test, and serology screening to reduce the risk of transplant rejection. Patients are treated with immunosuppressive drugs that will dampen their immune responses. Immunosuppressive drugs are given in 2 phases, an initial induction phase involving a high dose and later maintenance phase that involves using the drug in the long term at a lower dose. Future transplant therapies include stem cells that could have a major impact on transplantation in the future beyond their current use in treating blood disorders. The manufacture of organ scaffolds use 3D printing and then growing stem cells around these scaffolds to officially replicate the tissue being replaced. Improving compatibility testing between donor and recipient could also reduce the risk of transplant rejection and increase the longevity of the transplant. Rheumatoid arthritis is a long-term condition that causes pain, swelling, and stiffness in the joints. The condition usually affects the hands, feet and wrists. There may be periods where symptoms become worse, even known as flare-ups or flares. A flare can be difficult to predict, but with treatment it's possible to decrease the number of flares and minimise or prevent long-term damage to the joints. Some people with rheumatoid arthritis also experience problems in other parts of the body, or more generally symptoms such as tiredness and weight loss. Rheumatoid arthritis is an autoimmune disease. This means your immune system attacks the cells that line your joints by mistake, making the joints swollen, stiff and painful. Over time, this can damage the joints, cartilage and nearby bones. It's not clear what triggers this problem with the immune system, although you're at an increased risk if you are a woman, you have a family history or rheumatoid arthritis and you smoke. There's no cure for rheumatoid arthritis. However, early diagnosis and proper treatment enables many people with the condition to have periods of months or even years between flares. This can help them to lead full lives and continue regular employment. The main treatment options include medicine that is taken long term to relieve symptoms and slow the progress of the condition, supportive treatments such as physiotherapy and occupational therapy to help keep you mobile and manage any problems you have with daily activities, and surgery to correct any joint problems that develop. Depending on how much pain, stiffness or joint damage you have, daily tasks may become difficult or take you longer to do. You may have to adapt the way you do everyday tasks. Having rheumatoid arthritis can lead to several other conditions that may cause additional symptoms and can sometimes be life-threatening. These include carpal tunnel syndrome, inflammation or other areas of the body, and an increased risk of heart attack and stroke. Making sure that rheumatoid arthritis is well controlled can help to reduce your risk of these complications. Lupus. Lupus is a long-term condition that causes joint pain, skin rashes and tiredness. There's no cure, but symptoms can improve if treatment starts early. Lupus, also called systemic lupus erythematosus, is not always easy to diagnose because it can be similar to other conditions. Symptoms include inflammation of different parts of the body, including the lungs, heart, liver, joints and kidneys. The GP will usually do some blood tests. High levels of the type of antibody combined with the typical symptoms means lupus is likely. You might be referred for x-rays and scans for your heart, kidney and other organs if the doctor thinks they might be affected. Once lupus is diagnosed, you'll be advised to have regular checks and tests, such as regular blood tests to check for anemia and urine tests to check for kidney problems. Lupus often flares up and symptoms become worse for a few weeks, sometimes longer. Symptoms then settle down. The reason symptoms flare up or settle down is not known. Some people do not notice any difference and their symptoms are constant. Lupus is generally treated using anti-inflammatory medicines like ibuprofen, hydroxychloroquine, or for fatigue and skin joint problems, and steroid tablets, injections and creams for kidney inflammation and rashes. Two medicines, rituximab and belimumab, are sometimes used to treat several lupus. These work on the immune system to reduce the number of antibodies in the blood. Although medicines are important in controlling lupus, you can help manage your symptoms and reduce the risk of it getting worse by using high-factor sun cream. Learn to pace yourself to avoid getting too tired. Try to stay active even on a bad day. Try relaxation techniques to manage stress. Wear a hat in the sun. Tell your employer about your condition. Ask for help from family, friends and health professionals, and eat healthy, balanced diet, including vitamin D and calcium. Lupus is an autoimmune disease. This means the body's natural defense system attacks healthy parts of your body. It's not contagious. The cause of lupus is not fully understood. Possible causes include viral infections, certain medicines such as sunlight, puberty, childbirth and menopause. More women than men get lupus, and it's common in Black and Asian women. Lupus can cause complications in pregnancy. Seeing a doctor before trying to get pregnant to discuss the risks, and so your medicine can be changed if necessary. Active immunity results when exposure to a disease organism triggers the immune system to produce antibodies to that disease. Active immunity can be acquired through natural immunity or vaccine-induced immunity. Natural immunity is acquired from exposure to the disease organism through infection with the actual disease. Vaccine-induced immunity is acquired through the introduction of a killed or weakened form of the disease organism through vaccination. Passive immunity is provided when a person is given antibodies to a disease rather than producing them through his or her own immune system. A newborn baby acquires passive immunity from its mother through the placenta. People can also get passive immunity through antibody containing blood products such as immune globulin that may be given when immediate protection from a specific disease is needed. The major advantage to passive immunity is that protection is immediate, whereas active immunity takes time, usually several weeks to develop. However, passive immunity lasts only for a few weeks or months. Only active immunity is long-lasting. The immune response doesn't always win against the harmful bacteria or virus. Vaccination is the safest and most common way to gain immunity against a bacteria or virus that your body has yet to meet. Vaccines contain a harmful form of the bacteria or virus that causes the disease you are being immunised against. The bacteria or virus will be killed, greatly weakened or broken down in small parts before use in the vaccine so that they can trigger an immune response without making you sick. Your immune system will still attack the harmless form of bacteria or virus from the vaccine and will produce antibodies to fight it off. The immune system then keeps a memory of the disease, so if a vaccination person encounters the disease years later, their immune system is ready to fight it off and prevent an infection from developing. Before the introduction of vaccines, childhood deaths were more common from diseases such as measles, polio and whooping cough. Although these diseases still exist, vaccination provides greater protection against serious complications from these infections. Measles was first vaccinated against in the UK in the late 1960s with the introduction of the MMR vaccine in 1968. Since the measles vaccine was introduced in the UK in 1968, Public Health England estimates that 20 million measles causes and 4,500 deaths have been averted in the UK. This can be compared with the data regarding measles deaths from 1940 onwards to see the effect that vaccination against measles has had in the UK. From 2000 to date, there were 8 deaths in children or adults in England and Wales that could have been prevented by the UK National Immunisation Programme. Like the infection was acquired in England or Wales, and the individuals were eligible for a measles-containing vaccine in this country. There were 3 deaths reported that were due to measles infection acquired abroad in non-UK born individuals. There were 10 deaths reported where measles infection was acquired before 1968, when the first measles-containing vaccine was introduced. All reported deaths have been in individuals who have not received any measles-containing vaccine. When a high percentage of the population is vaccinated, it's difficult for infectious diseases to spread because there are not many people who can be infected. This is called herd immunity, and it gives protection to vulnerable people such as newborn babies, elderly people, and those who are too sick to be vaccinated. For individuals, the most direct benefit of vaccination is the protection from the infected and disease for themselves. and the people they are close to, and the knowledge of having protection. A vaccine is offered in pregnancy that can give the baby immunity against whooping cough, and all children are offered vaccines against rubella that poses more serious risks in pregnancy, and against mumps that can reduce sperm count and fertility. The risk of diseases and their effects are key factors in motivating vaccination uptake. However, real and perceived risks are also key factors, motivating people to reject the offer of vaccination. Some individuals who are generally critical of vaccination emphasise long-term unknowns about vaccines, the limit of its safety trials, or more generally the limits of the scientific knowledge about health and the body. A cultural shift towards a more individualised view of medicine and healthcare might also be reflected in the way people make decisions about vaccines. A significant drop in uptake of the MMR vaccine in the UK in the early 2000s was linked to media coverage of claims, subsequently shown to be incorrect, that the vaccine was responsible for autism in some children. However, recent studies have found that relying on mainstream media for news is generally associated with positive attitudes to vaccines. A lack of trust can relate to suspicions about motives and interests driving vaccination programs, such as perceptions of the influence of pharmaceutical companies.